Good afternoon, and thank you for joining us for this webinar titled Seeing Beyond the Diagnosis, Understanding and Reducing Stigma in MASLD and MASH. I'm Craig Lustig, and I am the Program Manager for the Global Liver Institute's Fatty Liver Disease Program, and I am joined by Neha, our Program Coordinator, and Nia has really led the effort to put this webinar together on behalf of the Global Liver Institute, and I'm really grateful to her.
Today, we're discussing an issue that many people living with liver disease experience, but one that isn't always openly talked about: stigma. Our hope is that this conversation helps people feel less alone, more supported, and empowered to advocate for themselves and others. So, at the Global Liver Institute, everything we do is centered around improving the lives of people and families affected by liver disease. Our work is grounded in patient-centeredness, collaboration, and inclusion, which makes today's discussion particularly important.
Many patients feel blamed before they feel supported, and the advocate has joined us today, Dianne Gillard. To quote her, she said, "People saw me as a fat person who needed to lose weight, not as a person." We know that MASLD and MASH affects millions of people worldwide. Many patients experience shame, dismissal, or misunderstanding. And unfortunately, these experiences are not uncommon. Yet patients experience all these kinds of things, and ultimately they can lead to a delayed diagnosis, misdiagnosis, delayed treatment. And I think it's important to note here that it's not unique to just MASLD and MASH. We think about this along the entire continuum of liver diseases, including things like liver cancer.
By the end of today, we hope you'll better understand what stigma looks like, recognize how it affects care and emotional well-being, and leave with practical ways that patients, providers, and healthcare systems can help change the narrative.
One of the most common misconceptions is that liver disease is simply caused by poor choices. In reality, these conditions are influenced by many factors, including metabolism, genetics, diabetes, cardiovascular health, environmental factors, and social determinants of health. No one should be blamed for having a chronic disease. And as we said, GLI is really here to work with our patients, to empower our patients and our caregivers, and to address issues of stigma.
So, stigma can come from many different places. It can come from society, family members, or even the media. It can become internalized, leading to guilt and self blame, and it can also exist at the system level through delayed diagnosis, fragmented care, or lack of awareness.
We know that patients often feel dismissed or misunderstood. Many patients have heard phrases like, "Oh, it's just fatty liver," or "You just need to lose weight," or maybe "You don't look sick." Even when these comments are unintended, they can affect trust in our healthcare systems, mental health, and a willingness to seek care.
Ultimately, we want everyone to understand that stigma affects much more than just feelings alone. It can create a cycle where fear and shame lead people to delay care, disengage from treatment, and ultimately experience worse outcomes. The encouraging news is that earlier support and compassionate care can interrupt that cycle.
And we know that there's now global recognition, and it's changing the conversation. We're seeing growing awareness, increased advocacy, and expanded screening efforts and global recognition of steatotic liver diseases. Patients and advocates have played a critical role in driving this progress, and their voices are helping to change perceptions around the world.
And while stigma is not the patient's fault, there are ways to empower ourselves and others. Seeking care early, asking questions, challenging self-blame, and finding community are all powerful ways to advocate for ourselves. Perhaps most importantly, having MASLD, MASH, or any other liver disease is not a moral failure. And of course, no presentation could capture the lived experience as well as the individuals who have navigated these challenges firsthand. We're honored to be joined today by our patient advocate and GLI ambassador, Dianne Gillard, who is an Advanced Advocacy A3 alum from the United Kingdom. And we would also like to welcome Dr. Alisha Honore-Felix, who is a lifestyle and functional medicine practitioner calling from the Commonwealth of Dominica.
Great. So, Dianne, we'd like to get into a couple of questions and really a dialogue with you about your experience. And excuse me, I'm suffering from a little bit of allergies in our part of the world. So, can you start out by maybe telling us a little bit about your journey and kind of your experience with your liver disease, and when stigma first became kind of apparent to you, whether that came from your community, your healthcare provider, or someplace else?
So stigma for me, it's always been there because of my size. So when you go to the doctors, the first thing they do as you walk through the door, they see the fat lady that needs to go on a diet. They don't see that you can be suffering, which I didn't know. It turned out 29 years from my first symptom, when I looked back, that I actually had the first symptom of having fatty liver disease. And it was only 29 years later that I actually got the diagnosis, because it was, oh, you need to lose weight. Join Weight Watchers, join Slimming World. So the stigma from that side of it has always been there all the time I've been overweight. But thinking about it, I had diabetes, I had the obesity. All those things are a symptom of fatty liver disease, but nobody ever talked about it. I didn't even know about MASH or MASLD. It was just something that I heard about once I got a diagnosis. So I know they say it's a silent disease, but we need to make it more out there and to be more heard. Because had I known some of the things that I knew, I could have then spoke up for myself and said, look, you know, I'm feeling this or I'm feeling that. Don't look at it that it's because of my size. There is something definitely wrong. And then obviously finding out what was wrong sort of made me quite angry, really. And then I mentioned to somebody very close to me that I had liver disease, and their answer was, well, maybe you shouldn't drink so much, and then also you wouldn't be so fat. And that hit a chord. And like I say, it's not just fatty liver. The amount of people that I've met that have said, oh, I've just got fatty liver disease. And I think, no, it's not just fatty liver disease, because we're prone to getting more serious illnesses from that as well. You know, we're prone to heart attacks, to strokes, you know, everything's all a combination. And it does frustrate me quite a lot that really for me, a GP didn't notice that all them years ago. And even having a scan in 2013 that actually showed up fatty liver, enlarged spleen and gallstones, it wasn't until 2021 that I actually had another scan, and he said, oh yeah, we've had this conversation before. And it was just left from 2013 to 2021. So when I first had the scan, I might have only had stage 1 or 2 MASH or MASLD. By the time I got diagnosed, I was stage 4.
You know, Dianne, everything you have said, first of all, you're an incredible advocate in terms of your understanding of this continuum of disease and the idea that you had what we would call sort of comorbidities that should have really been a signal to your GP to ask questions of you, or to do things like getting you a scan much earlier on. And I'm so sorry to hear that you had such a prolonged delay in getting this accurate diagnosis. Do you think this is really comes from the medical system, whether it's maybe unintentionally, but if you're exacerbating this stigma by making judgments about you? And maybe a kind of a part two to that question, which is, how did this affect you in terms of your willingness to seek further care, whether it be with that provider or a different provider?
I think it just makes, from my point of view, it was like every time I wasn't well, I was made to feel in a way a bit like a hypochondriac. Because I would go to the doctors and I'd say, right, this is happening or that's happening. Yeah, well, you do need to lose the weight. And I think when doctors are training, you've got the heart disease, you've got the cancer, I suppose you've got the diseases that everybody wants to deal with. But when you look at liver disease, we are up in that category. We are just as bad. We need just as much focus on what we've got wrong with us than somebody. I'm not sort of putting down cancers or heart disease, but we are just as important. And I think doctors, when they're learning, they need to bring liver disease. If they say 1 in 3 adults and 1 in 10 children have MASH or MASLD, why is more not done? I mean, I'm lucky now that I've got a GP in my surgery that's only been there a couple of years that recognises liver disease. He recognises MASH and MASLD to the point where he actually tested both my sons, and they're 34 and 32. And because of what I had wrong with me, he tested them and we found out that they've both got fatty liver disease as well. Now, if I hadn't have had that GP, that change of GP, my boys wouldn't know that they have that disease, and they'd be like me. They'd be in their late 50s before they find out that they've got something seriously wrong. And for stage 4, there is no medication. Stage 1 and 2, you can do something about it. Stage 3 and 4, there's very little you can do but manage it rather than cure it. And that is frustrating as well, because I think we should put more into looking at screening, looking at education, and even getting doctors to listen to us. GLI gave me a voice, which I want to use, but it's trying to get that voice across to GPs that are sort of set in their ways and, like they say, oh, it's just a fatty liver, don't worry. It's not just a fatty liver, don't worry.
Yeah. And you make some incredible points in terms of, you really found your voice, you self-advocated and really then further and went on to advocate for your family, right? And that is so vital and something that our A3 program is really focused on, which is providing patients and caregivers with this training so that they can really elevate their voice. Maybe I'll just turn it over to you for the next couple of questions.
Sounds good. And Dianne, my next question for you is, were there particular individuals, providers, or communities that made a positive difference in your journey?
Yeah, I went to the hospital in 2021 and I saw a doctor that actually knew Dr. Stigma at King's College Hospital. And she done a FibroScan on me and said, we have a problem. I'm going to refer you to Dr. Stigma at King's. And she actually saw me the very next week. She saw me within 3 or 4 days. And since meeting her and getting a diagnosis and having a doctor that listened to me, that knew what was wrong with me, it made such a big difference. It really did. And then obviously with going to EASL, with Boehringer, that sort of highlighted more for me to find out just how many people have this disease that don't even know they've got it. So with obviously Dr. Stigma, I don't think I would be here without her. And she's very good and she listens and she gives you the time, and it's not a quick rush in, rush out, which with some doctors it's like, oh yeah, boom, 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 there you go, off you go. It's not like that with her. And then, as I say, just sort of the culmination of those three things, I actually felt that I wasn't a hypochondriac anymore, that what I had, the feelings that I had and what was wrong with me were actually real things going on and not just because of my weight. And that for me was a positive after all them years. You know, it was just, it's like a weight, it's like a relief has lifted. And you actually think, well, yeah, now I know what's wrong with me. Yes, some of it can be your own fault. I'm not going to say it isn't, because obviously lifestyle does lead a big part of it. But if I'd have known before, you know, the way things are today, I had disabled parents, I had disabled husband, you know, I was working full time. So it's life, isn't it? Life is so different today. You know, takeaways are quite easy meal when you've come in at 7, 8 o'clock at night. So yeah, that part of it, yes, you've got to take some responsibility, but to actually know that there was actually something wrong was a big relief.
Thank you so much for sharing. I think that your anecdote about Dr. Sima and meeting her is very refreshing to hear, and I'm sure it'll be very refreshing for many patients to hear as well, as I'm sure that there are many other people out there that are seeking to have that sort of breakthrough moment in their diagnosis in which they felt in which that they could rely on someone at that point forward. So I think that is very insightful. Thank you. And my next question for you, Dianne, is what do you wish people better understood about living with liver disease in particular?
It's not an easy thing to live with because, like you say, sometimes you can look very healthy, so people don't think that you're sick. It's a bit like the disability thing, isn't it? If you've got a missing limb, then you're seen as disabled. If you haven't, then, you know, the comments are, well, there can't be anything wrong with them, they're fine. But obviously we're not fine. So, yeah, there's that side of it as well. What was the other question? Sorry.
What do you wish people better understood in general? But I think you kind of hit on that already.
Yeah. I just wish people would be more educated and would, you know, if there was something out there that it was advertised, that there is this problem, then people would understand, I would hope, a lot better than what they do now. Because unless you actually suffer with it, I'd never heard of it. You know, you hear about lung cancer, you hear about heart attacks and things like that. You hear about people that are alcoholics that have got a liver problem because that's society and that's what, you know, that's where the stigma comes from. Oh, well, you've only got a problem with your liver if you drink too much, which it isn't that, is it? But until 2021, I'd never heard of MASH, MASLD, you know, that sort of liver problem. It didn't relate to anything that I'd ever heard about.
Diane, I think you bring us a lot of hope. Honestly, your story is certainly full of some real challenges, but in terms of, I think, how you've come at this and become an advocate, it certainly gives me hope that adding your voice is going to change other people's lives.
I hope so.
Are there any other messages that you would like to leave with patients who may be struggling with feelings of shame or isolation after their diagnosis?
Don't feel shame. Don't feel isolated. If you've been diagnosed and you're under that part of the hospital, for me, once I was diagnosed, I was seeing other patients in the clinic. Talk to each other. You know, it's a silent disease, but make it heard. Talk. Don't hide away. Don't feel ashamed. You've got nothing to feel ashamed for. Hold your head up high and be proud of what you can achieve when you use your voice.
Next up, we will be interviewing Dr. Alisha Honore-Felix, who is a lifestyle and functional medicine practitioner calling from the Commonwealth of Dominica. Dr.
Thank
Alisha,
you for having me.
Thank you. Thank you for coming here today. Can you please tell us a little bit more about who you are your journey with fatty liver disease, and when stigma first became apparent to you and how it's influenced your career.
Okay. Thank you so much for having me. As you mentioned, I'm from the Caribbean, the wonderful nature of Dominica, and I'm currently living in St. Lucia and practicing there through my clinic called Serena Care Wellness Hub, where I'm seeing patients diagnosed and living with obesity, fatty liver disease, hypertension, and other chronic metabolic conditions. I'm also a health coach and a board certified lifestyle medicine physician. My journey with MASLD is both professional and personal. As a physician, I've noticed the number of patients being diagnosed with fatty liver disease, often through some incidental finding on some blood works or through, let's say, an abdominal ultrasound. And they're just being told to lose weight or eat healthier or do some exercising, but not much education is given or not much support or follow up. And I had to experience that myself as a patient. So stigma became firsthand to me when I was diagnosed with fatty liver disease. And the doctor just looked at me and said, "You should know better. You are a doctor," without even asking me my story, my challenges, or anything like that. And I felt judged because, true, I was overweight, but at that time, I did not feel that that was what I needed to hear. I needed the support, I needed the love, I needed the hand held in order to take me through, but I did not get that. And so I created the space, Serena Care, not only for patients with fatty liver disease, but with any type of condition that they need their hands being held through and to not be stigmatized. What most people forget sometimes that as healthcare professionals, that we are human beings as well, and we make mistakes. We eat things we're not supposed to. We are stressed. We're overworked and stuff like that. So we should not be judged. And the same for patients, because of their genetics, because of their socioeconomic status, because of so many things, they end up being diagnosed with fatty liver disease and other conditions. So it's important that we listen to them before assuming and jumping to conclusions and partnering with them, meeting them where they are in order for real change to happen.
Thank you so much for sharing. I think that is extremely insightful for our community to hear, as everyone wants to experience compassionate care. And your experience as a patient clearly translates into how you go about your medical career as well. So I think that's very powerful to hear.
Thank you so much for that. I mean, I'm grateful for that experience because without it, I don't know what type of doctor I would be. Maybe I would not be that empathetic, or but now I am more understanding. I am more determined to help people with these conditions. And I must say, through the partnership with GLI, the Global Liver Institute, over the past years, it's further opened my eyes to even more things, more about patient advocacy, support groups, awareness, reducing stigma. Most importantly, that and it has my interest so much that I want to do more research on fatty liver disease and other metabolic conditions to see where we are right now. What are we doing in terms of prevention, management, treatment, and how we can make the Caribbean a healthy Caribbean and the world by extension. So I thank you.
That's wonderful. Thank you. And with that being said, have there been particular moments in which you noticed that the medical system could be unintentionally exacerbating stigma?
Yeah, well, I mean, first that I got to experience what it was
Of
like as
course.
a patient to be diagnosed as with fatty liver disease. But absolutely, I'm sure there are many untold stories. But if you ask me personally, the biggest challenge is not knowing why someone has the condition, even without doing blood tests or anything like that, and already judging them. Yes, lifestyle medicine plays a very important role. So does genetics, so does environment, so does stress, so does sleep, finances, culture, access to healthcare, especially in the Caribbean. Our socioeconomic status may not be like those in the developed countries. So a lot of that can contribute to why someone has that condition, and we are stigmatizing them for that. I mean, I have seen patients who are genuinely trying to work on themselves, improve their health, but they're still struggling because unfortunately when they go to their healthcare facilities, and they're left with the feeling of feeling blamed or unsupported. They would rather go home and cry and be depressed and maybe have more emotional episodes of eating and not doing anything for themselves, instead to go back in a place where they're not supported and not feeling love. So that is one thing for sure. I realize that has been happening a whole lot, and I hope that we as physicians can make that change and create that space that patients need for them to express themselves, but also to thrive, because we're going to give them the education and all that they need, but they need to be able to feel welcome to express themselves so that we can help them. And I believe we need to spend more time understanding what are their stories before just assuming about their health.
Thank you. And I believe that what you just mentioned just now really emphasizes something that I've heard from many of our patient advocates, which is that there's so much beyond what's at surface level. And it's up to us now to understand that we can't assume or judge right away without knowing the full picture.
That's true. Never judge a book by its cover.
Exactly.
Yeah, so true.
And were there particular individuals, providers, or communities that have made a positive impact in your journey?
Uh, Definitely. I would say GLI a whole lot. I mean, the relationship with GLI through Larry and Donini and Kat and yourself. I mean, it's just a couple years, but I have learned so much through just being there. I mean, I'm the voice for the Caribbean at that level, but just being supported and feeling welcome and be able to share, not just as a physician, but as a patient as well. I am definitely on a whole different level, and I get to be on that team and also come back to share that experience with other patients and other physicians so that we can all be on the same level. But those experiences have definitely shaped the way I practice medicine. I'm not sure if I told you this story before, but my whole mindset changed after I got to be my mother's caretaker before she passed away from cancer. And then just going deeper into lifestyle and functional medicine and learning more and being involved in groups such as GLI and Diabetes Association. Like, I'm the vice president of the Dominica Diabetes Association right now, and I get to be part of the NSE team as part of the International Diabetes Federation. So being part of those groups, organizations, associations definitely gives me the support, the education that I need to come back and educate others, other physicians, other healthcare professionals, so that we can help our patients in a better way. I want to create the type of an healthcare environment that I don't feel like I felt when I was diagnosed with fatty liver disease the first time. A place where people living with these metabolic conditions can feel heard and understood and supported. And that's what healthcare should be about: partnering, meeting the patient or the client where they are and helping them to, where they're weak, help them to be strong, and where they're strong, use that strength to further strengthen others. So patients should be able to understand their bodies, what is happening in their bodies, and why they have certain conditions, and why recommendations are being made, and how they can actively participate in their health, instead of the doctor just saying, do this, do that, and you don't understand. Because the doctor is not always going to be with you 24/7. You're home by yourself all the time. You come to the office maybe 30 minutes, and the rest of the time you're home. But if you understand why you're doing this, why am I taking care of my health? How am I going to manage this? Then you're more educated to make informed decisions for yourself. And my role is not to control any person's journey. My role is to support, and that's what we should be doing as physicians: educate, guide, support, and empower them. So when people understand the why behind lifestyle changes and treatment recommendations, they are more likely to stay motivated and make the changes that they need to be healthy, and if possible reverse conditions like fatty liver disease and other metabolic conditions.
Thank you. I think that what I'm taking away from this right now is that you believe the role of the provider should be to empower the patient in order for the patient to take ownership and autonomy of their health again. Is that correct?
Definitely. Because if we just put them on medications, the medications are only going to do what they're supposed to do: bring up the sugar, low down the sugar, or try and reverse the fatty liver disease. But if the patients are not empowered or educated to make informed decisions, then we're fighting a losing battle.
And what do you wish people understood about living with liver disease?
So many things. But because of time, what I would want to share is it is a complex metabolic condition and it is influenced by many factors: genetics, lifestyle, environment, and overall metabolic health. I also want people to understand that there is hope. It is not a death sentence, it is not a life sentence. And it all depends on how you look at it. But if it is diagnosed early enough, you don't have to go through all of the terrible complications that can possibly happen. And you have to be willing to do what it takes. You cannot fight with old tricks that have not been working. You have to be willing to do what you got to do for you to be healthy. I mean, as a lifestyle medicine physician, I have seen how nutrition, physical activity, stress management, sleep, everything lifestyle medicine related, but also the social support and the appropriate medical care and timing, how it can help to improve liver health and other conditions. But again, once identified early, a lot more can be done compared to when it is late. That's why I believe, again, education, early detection, and ongoing support is so important when it comes to MASLD or MASH.
Thank you so
But
much.
yeah, and it's not a personal failure. It can happen to anybody. It doesn't. It has no how I could say it, it has no discrimination for any particular race or person, or anybody can have it. But if you do have it, or if you're at risk for it, and you do what it takes, then you can definitely get better.
And our last question today is, what message would you like to leave with patients who may be struggling with feelings of shame or isolation?
Mhm. First, I would smile for them. And I would say, if I can do it, you can do it. I would tell them that you are not your diagnosis. Having MASLD or having diabetes does not define your worth, does not define you, does not define your future or your ability to live a healthy and meaningful life. And that you should not let shame or you should not let anybody stop you from seeking help. You need to ask the correct questions. You need to advocate for yourself. If you need to find me or any other provider that creates that space, please do that. But I also want to tell my colleagues, most importantly, as healthcare professionals, to remember that we are treating people and we are not treating diseases, that we should uh, encompass the holistic approach and not just look at the person and say, oh, high blood pressure or fatty liver disease. You have to treat the entire person mentally, spiritually, emotionally. And to every patient that is listening to my voice and seeing my pretty smile right now, learn about your condition, ask questions, get the support that you need, and remember that progress takes time. Practice makes perfect. If you have it for a long time, it's not going to go away overnight, but every step in the right direction is a step forward. And we have one life to live. And if you're not living it at your best and your healthiest, then who's going to do it for you? Your health matters, your condition matters, your voice matters. Advocate for someone if they can advocate for themselves. And if you do not stand up for your health, who's going to do that for you? Most importantly and lastly, there is hope. And if there is hope, you're not alone. I am here with you. GLI is here with you, and your story is far from over. That's what I would tell them.
Thank you so much.
Thank you for having me.
So I think we'll close things out today with that. I think the message we heard from Dianne, and it's really important here, is that liver diseases are medical conditions, and it's not personal. It's not a personal failure. We know that stigma is real. We know that early detection matters, as Diane talked about, and it really can be really pivotal when there is a delayed diagnosis. Compassion improves care. What a lovely statement. The idea that if we could all listen to each other, if we can encourage our healthcare providers to listen, these things are vital, and that we can make change. And somebody like Dan shows that we are making change because she's at the forefront of this as an advocate, who's somebody who's really educated herself about the spectrum of disease, and I'm certainly very grateful for her. And finally, I guess I'll just say thank you for everyone who joined us. You just put up our various communication channels. We have a host of programs and activities that you can be engaged with, and we encourage you to visit us at all our different sites and be part of our community, and stay connected to us. Thank you.